Hiya, I'm Teoh, obstetrician, gynecologist, and fertility specialist in Perth. Today I'm going to talk about the techniques and secrets of IVF success. Like mentioned before, it is like managing a F1 team. What is influencing the success is multifactorial, as we know. You need good driver and good team, you need to have good planning, and also you need cutting edge technologies to reach the pinnacle and win the race. Likewise, in IVF, there are many things you really want to carefully consider to have a good outcome. As we know, it is not 100%, but you should push the success rate as high as possible for patients' time, effort, and money to be worthwhile. Now, for today's topic, I'm going to simplify the whole aim of IVF. It comes down to three equally important factors. I call it Joo'S golden triangle. Number one, you need the best quality embryos. This is achieved by optimizing and designing the best regime used to stimulate the ovaries and also plan carefully on the timing of egg collection. Patients should also be advised to optimize their lifestyle to maximize the potential for producing good quality sperms and eggs to create good quality embryos. Number two is to optimize the environment to nurture the embryo, which is inside the endometrium, the lining of the womb. So we also want to check that all hormones are well balanced when the embryo is going back in and the lining is thick enough. We want to treat other factors which can affect the embryos from implanting and growing. For example, if there's any endometriosis, if there's any presence of fibroid, polyp, any antibodies or immune cells that may badly influence the environment. So this is number two. Number three is a technique of embryo transfer. Essentially, you want to gently and gracefully place the embryo in the perfect place inside the lining without doing too much disruption. I believe we can only achieve this with experience and also using ultrasound scan as a guidance. Now, I'm going to show you the embryo transfer catheter. There are two components. So this is the outer sheath, and this one is the inner catheter. So usually to do the the specialist will take the outer catheter, and the embryologist will prepare the inner catheter. Basically, the embryologist, they from the plate they load the embryo. This is where they put the embryo inside, ready to be replaced, to be transferred back inside the womb. And the doctor is using this to negotiate the entrance to, the womb usually is a bit bent, so we need to make sure it is placed nicely and ready for the inner catheter to go in, because the inner catheter is a bit soft and it's hard to manipulate it or insert it inside where it meant to go. So you use this. It is slightly harder, not very hard, because it's too hard can affect success rate. So and then you put it in the cervical canal, the cervix, and then the embryologist will bring in the inner catheter. So gently, as mentioned, as you see here, it will come up from inside, and the embryos can be put inside the womb. So using this model, so firstly, without the inner catheter, you want to slide the catheter in the outer sheath to the cervix, and you stop there. You don't want to go too far, because if you go too far, you actually can disrupt and cause damage to the lining inside, which is not good at all, and cause bleeding as well. So you want to go into certain level, you feel and use ultrasound scan, and you know, okay, it's the place to stop. And then gently, you can see, you can put the inner catheter slowly coming in. And then usually at about, if you see the top, at about 1 to 1.5 centimeter from the top, and that is the best place. You release the embryo inside gently, so it stays inside. Hopefully it stays in there, stick in there, grow into a baby for us. And also, if you have a full bladder during the transfer, it's slightly better. Full bladder serves two purposes. Number one is it straightens the womb. As mentioned, most wombs are a bit curved. So imagine you try to put a straw through a curved canal, a curved space. It's a bit difficult, but with experience it's manageable. But if you've got a full bladder, you push the womb a bit straighter so it can go in, slide in a bit easier. The easier it is, the better for the outcome. And also the full bladder creates a window for you to look at the womb so you can see it clearly when you put the embryo inside, as mentioned in these straws coming in nicely. All right, that's it for today. Bye bye.